I'm an addictions professional. I've also worked in a psychiatric hospital. So I've seen individuals coming and going all the time with the delusions, the hallucinations. I worked on, I think, every unit in the hospital. So I've seen situations where there have been a lot of individuals, young kids, who have had psychotic breaks as a result of smoking marijuana. Part of it could be the levels of THC, which alter your perceptions to begin with. It's the active ingredient. In addition to that, you don't know what you're getting, and a lot of it is mixed with a lot of other stuff.
Yeah.
And there's chemicals such as PCP and a lot of hallucinogens that are mixed in with it, and people are unaware of it. So, you know, I could share story upon story. I don't want to bore anybody with it, but that's the essence of my experience.
Well, a lot of people use marijuana and other medication and alcohol as a way of managing their feelings.
Right.
Not because they want to get high or crazy, they just want to take that medication.
Self-medication.
I want to change the subject back to you a little.
Okay.
I'm a little older than you.
I'll be 75 this month.
Monday I'll be 81.
Okay.
As a result of all this mental illness and breaks and hospitalizations of my family, I had a lot of problems. I found the answers to me in Al-Anon, the 12-step program. Now, when you said obedience, that was my defect that I found in Al-Anon. I was obedient. First I obeyed my father, then I obeyed my husband, on and on. And I learned in Al-Anon our defects are our assets gone awry.
That's good. Thank you for that. That's a great contribution. Yes.
Yeah, I've worked with patients for a long time, and I have several bipolar 1 patients right now. And once they get to the marijuana, it's not only the drug that they're using, it goes along with all of a sudden they're back to their old friends. Let's say they were doing well. They started on medication. They're not using the medication, but now they're on marijuana, they feel better. So they're back with their old friends, they're back doing old behaviors.
Right.
So already their whole thoughts, see, I call it all like a thought disorder. So, you know, their thoughts have changed. Now they're drinking with the marijuana, then they're also using X, which is ecstasy also. And before you know it, they're using several drugs.
Right.
And also, I love what this gal said up front, which is that it's all mixed with everything.
Right.
And the last thing I want to say is that, you know, these kids tell me, oh, well, you know, it's legal. Now marijuana, you know, it's going to be legal. And I tell them, well, you know, alcohol is legal also, but that doesn't mean you walk into a store every day and go and get alcohol and you're free to drink as much as you want. So marijuana can be legal, which of course I hope it isn't. But, you know, the idea is it doesn't mean that you can do it because it's legal.
This is the juxtaposition of where the biochemical meets the environmental, and that's why you need both the
And it's
chemical
very
and the
diverse, especially when there's a mental health factor, but even without it, it can create.
And today I heard on CNN before I came here that California is trying to initiate a new law whereby it's going to give families the right to be able to take guns away from their family members that they feel can be harmful to other people or themselves. Don't ask what the gun control people are saying, but they're trying to say, look, it's not the guns, it's the people that are using the guns, and if we have family members, not neighbors, family members that we feel are potentially dangerous to themselves or others, we have the right to be able to take the guns away from them. That just happened today.
Can I say one more thing about Risperdal? Just so people know, because I did not know this, and I've been practicing for 24 years, and I'm a psychologist. I know a lot about meds. Risperdal comes in a shot, and you can take, they have shots now for every 2 weeks. That's the bomb. That's terrific.
That is good.
That is really good. So, you know, I'm afraid if they take it by mouth, they can go and still rinse out their mouth and still try to gurgle it out. it's a possibility, it's a great thing that now it melts in your throat, but the shock, and I had someone that's schizophrenic and he has a lot of bipolar symptoms.
Yeah,
He came in.
there's so much comorbidity. There's
Oh,
so
but
much
he was
comorbidity.
just terrific, and he was violent and aggressive, and he's like a different person now.
Yeah.
What is he
Yeah,
taking?
medication?
The medication is Risperdal and a shot.
Every 2 weeks, I have something.
It's every 2 weeks.
Well, and I want to thank Marcia, you and the Mental Health Association, and Mr. Pamela and Les, and Educational Center for allowing these kinds of programs to come here
Yes.
and to help not just the therapists, because most of the therapists know this stuff anyway. This was a personal representation of my life story that you can read more in the book, but allowing people like us, the public and the professionals, to know that you can pass this information on and hold your own meetings in your own offices, bring in your clients and give them what I'm giving you today in your own experience, both professionally and personally, because we've got to get the shadow of shame and the stigma out of mental health.
And we're going to do the panel program too. You are not alone. We're
Yeah,
going
I'm
to
going
bring
to
that
tell you a
here.
little bit about that. Books and Books, when they had me come and do my first book signing down at Books and Books, it was a terrible rainy night. And I said, how many people are planning to go there? And they said, oh, there'll be quite a few. I said, well, how many are you setting for? And they said, 75. I said, 75? I don't think there'll be more than 30. And I thought the 30 would be the 30 I was sending down there. I was like chills. So I said, no, it'll never happen. And I didn't market it. I put it on Facebook, which I guess is a form of marketing, and LinkedIn. And they do the same thing, and they put it on their social media. The day before, the Miami Herald wrote a gorgeous article about the book, Ana Veciana Suarez. And I think that that's what stirred. I'm not sure till this day what happened, but when I showed up, I was in shock. I was in shock. The place was filled to capacity, standing room only, and people were coming out of the other room. There were about 135 people that we couldn't even count. And I walked in and I said, I'm not even Hillary, look what's going on here. But basically what I learned from that is that people want to know. They need information. And most of them were not therapists. Most of them were the public that had heard about it in the calendar of events and the Ana Veciana Suarez story. And people want to know. So from that was a July 9th event, they called me, Books and Books called me and said, look, we'd like to have a series, maybe 4 times a year. Can you put something together? So in my own creative powers, I said, okay, let's do a panel. We'll call it You Are Not Alone, Coping with Mental Illness, 4 perspectives. I'll get a psychiatrist, I'll get a patient, I'll get a psychologist or a social worker or any mental health therapist, and I'll get a family member. I'll get 4 perspectives. When we got there, and the first psychiatrist, he was great, like Dr.
Christopher.
Lucia Treatment Center. And they did a lot of publicity too with their own social media. When I got there and they showed, it was again filled to capacity. There wasn't enough room to fill it. So this is important now. This is timing. It's timely, timing. Everything has its right time. And the world wants to know, especially because like you were telling, it's a brain disease. People are stigmatized because they think it's an emotional disease. But the fact that you get the word out, like it's cancer, I called it a brain cancer. That's how I felt that she was dying from. I didn't know she was going to die, but it felt like some kind of a physical disorder, not a mental disorder. So if we can continue to keep this kind of pushing out to the audience, people that want to hear about it. And Marcia, when we do that, people will come and they'll get the knowledge, they'll get the education, they'll get the resources, and they'll be able to find answers. Maybe we won't have all the solutions, but it's a beginning. You know, we got to start somewhere. Every journey starts with the first step, they say. Now the world wants to know about mental illness. Now
Can I
is the
say
time.
something?
Yes.
Especially because of the
Nanny.
school shootings and whatever.
By the way, I wrote to NAMI, I sent the book to NAMI, and I've never heard